Pectus repair surgery is performed to correct a sunken or protruding chest wall, most commonly pectus excavatum. During the procedure, the surgeon creates small incisions on the sides of the chest and inserts a curved metal bar behind the breastbone. The bar is then rotated to push the sternum outward into a normal position, instantly reshaping the chest. It stays in place for several years to maintain the correction while the chest heals and stabilizes. The goal is to improve breathing, posture, and overall chest appearance with minimal scarring and a safe, controlled correction.